Alright, so as far as herb-drug interaction, this is another main reason why I think drugs like Plavix, aspirin, and also Coumadin is very important. Because number one, these drugs are very, very frequently prescribed. And number two, herbs are also very, very frequently prescribed. And number three is both are frequently prescribed, and when you combine them together, they have very serious interaction with each other. So on your left-hand side, you have thrombolytic drugs, anticoagulant drugs, and also antiplatelet drugs. If you were to prescribe it with herbs that activate blood circulation, chances are they will interact with each other. They will have synergistic effect. So that means you have increased risk of bleeding and bruising. Okay, this risk has been definitely documented with Coumadin, and the reason is because Coumadin or warfarin has been out a lot longer, and there have been a lot of studies in which Coumadin is combined with Dansen salvia or Dangui angelica sinensis, and they definitely see an increase in concentration of the drug as well as effect of the drug. Plavix hasn't been out for quite as long. I'm personally not aware of any literature that documents Plavix with Chinese herb, but I think you should observe the same caution. All right. Opposite is also true. If you prescribe the drugs with herbs that stop bleeding, there is a good chance that they will cancel the effect of each other's and therefore increase the risk of clotting. And the patient now have a higher risk of heart attack or stroke and so on. And once again, with Coumadin, this is also well documented. In fact, if you have a patient that takes Coumadin and you prescribe herbs that stop bleeding, such as Shenhe Cao Agremonia or Diyu Sanguisorba, what happened is these Chinese herbs that stop bleeding, and I'll type it in the chat room. These two herbs have a large amount of vitamin K. Okay, and vitamin K counters the effect of Coumadin and therefore increase the risk of clotting. And basically, they cancel the effect of each other's. Okay, so that should be pretty obvious as well. So in any case, the bottom line is, if the patient comes in, they are taking Plavix, they are taking Percentin, they are taking aspirin, they are taking Coumadin, your hands are really tied, okay, because you really don't want to prescribe herbs that move the blood. You really don't want to prescribe herbs that stop bleeding, because in my opinion, the benefit is really not justified. There's too much risk. Okay, if you want to prescribe them, if you decide it's necessary, make sure you properly disclose all the risks to the patient. Make sure you talk to the medical doctor, so everybody that's involved have a good common understanding of what's going on. All right, it's probably better if you just stick with something that has a more manageable risk. Okay, such as acupuncture. Okay, acupuncture obviously has certain risk of bleeding, but if you do it right, I think the risk is definitely manageable. Okay, what I would generally do is, whatever the condition may be, when you are seeing them the first time, that massage the acupressure points first, see how the patient responds. And if it's not too bad, then you can proceed with acupuncture. But be careful, don't go overboard. Don't use very strong stimulating technique. Okay, try to avoid electrosteam if you can, and most importantly, stay away from the major artery, major veins. And when you take out the needles, make sure the bleeding is completely stopped before you let the patient go home, because chances are for these patients, bleeding will be more and they will last longer. Okay, so just make 100% sure that the bleeding is stopped before you let them go home. Other modalities of TCM, again, use your professional judgment. Okay, if you decide to do acupressure or if you decide to do Tuina, I think that's fine. Just don't go overboard. If you decide to do cupping, also be careful. Cupping tend to cause a lot of bruises, anyways. So don't go crazy with it. There are some practitioners I know that would like to do that, frequently does bleeding and cupping at the same time. So I think that's going to be too much for patients on anticoagulant and antiplatelets. All right, so use your caution. Okay, I have a quick comment here. Okay, let me do one more thing. There seems to be a lot of questions, and usually with anticoagulant and antiplatelet drugs, there seems to be more, because this is one of the most important topics. So let me wrap up this section on herb-drug interactions by showing you one of my favorite slides. This is a slide of 水蛭, which is Hirudo or leech. Okay, so for those of you who grew up in the farms or grew up in, I guess, more developing world, you obviously have seen leech before. And when I was a kid, I remember this actually quite well because some of my relatives used to be farmers. So on weekends when I don't go to school, I would go visit these relatives, and we'd go play in the farms. We would go catch frogs or go catch fish or just run around in the mud. And every once in a while, I would end up with a leech that stuck to my leg, and it would always freak me out. All right, so I remember running back to the house and get my uncle and my aunt to get rid of the leech. And one thing is, you cannot just grab it and pull it out. And the reason is because they really dig deep into your skin, into your muscle. And if you just pull it out, it hurts quite a bit. So the way to get it out is you have to get a match or get a lighter and burn the leech. And that's when they really fall off. Anyways, what's happening with the leech is that as they are attached onto the hose, they are basically having a buffet. They're having a all-you-can-eat buffet where they suck the blood out of the hose, and they do it until whenever they're done, whenever they decide to fall off and go home. And there's really not much you can do. You cannot just pull it off because it hurts too much. And also, as they suck the blood out of the hose, you really cannot stop it either. Okay, and the reason you cannot stop it is because the normal defense for an animal is that if you are bleeding, then you want to have a bleeding or clotting mechanism to stop bleeding. And that generally refers to the clotting cascade of a series of chemical reactions. But what happens is, as your body tries to form a blood clot to stop bleeding, leech simultaneously at the same time as it sucks the blood out, it injects its saliva into the wound, and within the saliva is a compound that's the most powerful anticoagulant in the whole world. All right. So whatever effort the host tries to do to stop bleeding is countered and overcome by the saliva inside the leech. All right. So what happened is, for thousands of years, humans have observed this, and Chinese doctors have observed this, and that's why we use 水蛭or Hirudo or leech as one of the most powerful Chinese medicinal substance to treat blood stasis. Okay, you want to reserve as a last resort because it is in fact very powerful. And Chinese culture is obviously not the only one that caught on to this special effect about the leech. Many other cultures as well, and that include the drug companies. So what happened is, in Japan, they have taken that exact substance and make it into an oral medication called Hirudo. Okay, in the United States, it's exactly the same. It's in an IV form called Refludin. All right, and it's in an injection. All right, so basically it's all the same. In Chinese medicine, this is called blood stasis, and it's treated with a blood-moving herb. In Western medicine, this is called a thrombus, and it's treated with an anticoagulant drug. So I hope this example helps to narrow down the difference between Chinese medicine and Western medicine. The terminology may be different for the disease and the medicinal substance, but oftentimes we're actually describing the same thing. Alright, so Lauren, if there are any questions, feel free to read it out, and I'll read whatever else that's in the chat room at the same time.